Okay, hello my YouTube family. It's so cold, I can't even move my lips. Anyway, hi YouTube. If you're new to my channel, welcome. And if you're a loyal subscriber, thank you. Woo! We got a lot to talk about. And as you guys know, it's cold here in Michigan. As you guys know, I'm out here waiting for my granddaughter. She's at her hour tutoring class. And this is when I usually get a chance to talk to you guys. So, let's get started. We're going to talk about these insurance companies and how they are screwing us seniors around. I'm telling you, if I didn't have low blood pressure, my blood pressure would be sky high and up to the roof by now. Okay? That's just how hard and difficult and the changes that they are and have been putting us all through as of starting January the 1st, 2026. They have lost their minds, okay? And I can lose mine right along with them. So, if you hear the heat here, that's because I'm in the car and it's a little cold. I have to thaw out a little bit. Anyway, go to Buy Me a Coffee and Ko-Fi. And I appreciate your continuous support. If you haven't supported me already, that's okay. We're in this together still. You know, I like to talk about what's going on in my senior life. And this is just bizarre. I thought last year around this time was crazy. They have lost their minds, okay? Especially United Healthcare. They totally lost their minds and they totally got me twisted. Or had me twisted, okay? Remember my video before this one or the one before that one? Anyway, I told you how they all of a sudden took over my home health care and my caregiver just out of the blue. Took me away from the state of Michigan. And Michigan been taking care of me since my disability 11 years ago. Well, my worker from Michigan, Michigan Human Health Services, called and said, Voltaire, as of January 1st, we no longer will be paying your caregiver, which is a family member. And I said, what? She said, you are no longer on our roster. And believe it or not, this was like a contradiction. I would no longer be your worker, but I will still be out there on a certain date, which is my 6-month evaluation every 6 months, 2 times out the year, or overlapping, which I didn't quite understand that. If you're no longer my worker, then how come you're still doing your visit? Anyway, it is what it is. It's always this double talk. But when she finally got to me, she said, look, don't shoot me. I'm just a messenger, which she was just giving me good information. But I still felt she could have gave me better information. But I found out later that she didn't know it herself. They keep them in a dilemma. Okay? They don't tell them everything. They just do what they want to do. So, she gives me these 7 numbers to call, which I conveyed to you guys. All right? Now, I started out right after that call that day. I started off calling those numbers, okay? The first number, senior advocate. Second number, Medicare. Third number, etc., etc., etc. And after talking to all of these people, their main objective and their main advice at the end of these long conversations was, turn on the back of your UHC card, your United Health card, and call them directly. Lord, my child, let me tell you, I figured it out by the second day, because after that first day, I was just too tired and exhausted to go through another agent. So, when I got my second win, I called them. I called United Healthcare the second day and told them that I would like to disenroll in you taking over my home health care. And this is the Medicare Disadvantage program, not the dual program, for what I understand, which is what I've had for the last 6 years since I first enrolled with them, but the Advantage plan. And I told them that I would like to disenroll and that Michigan continue to be my home health care providers. Okay, well, this certain agent said, well, God, you're the first caller that I've had pertaining to this. But all of those other numbers I told you about the day before, remember? They said they have been flooded with all of these calls. Flooded. So I don't know if it's a conspiracy or the way it was supposed to act out like this, because they're really not helping and they're really not giving any constructive advice. They're just on the phone talking, okay? And this is all because of Trump's big, beautiful bill. This is how he's doing his people here in the United States, especially his seniors. So, getting back. So, after being on the phone a good hour and a half, okay, with my UHC agent, she told me that, okay, you're disenrolled now. After checking off certain boxes and her hitting certain buttons, supposedly. She said you'll be getting a letter in the mail, and as of February the 1st, we will no longer be taking over your home health care. I said, fine, because they never notified me that they were going to do this. They did never, ever get a consent from me, and I never agreed upon this. I'm going to move up. Okay, guys, hold up. A parking spot just got available. So, supposedly, this is what this operator did for me, okay? Well, when my worker came for my visit, like 2 weeks later, she turned over on this piece of paper and she said, Voltaire, you're still with them. And because my caregiver have to do a task form, a checkoff list every day of what you do for me. Either clean my house, clean the refrigerator out, wash my windows, just things that I'm not able to do because of my limitations. That's why I have a caregiver. We get minimum. I get minimum help. And I'm the employer. My caregiver is the employee. So I get paid in order to pay them. That's how it goes. Michigan pays me, but it has both of our names on the check. If you're with the state of Michigan, or you can be with an agency. But regardless, both of your names are on this payout. And she said, you're still with them. I said, no, that can't be. It shouldn't took them no 2 weeks to disenroll me out of their program. She said, honey, as of now, you better call Medicare, because it all boils down to Medicare, okay? So after she left, I called Medicare, and she said, you are still with United Healthcare. And I almost blew my top, but I calmed down, because that gets you nowhere, okay? You have to be cool, calm, and collective when you're dealing with these people, especially over the phone. So far. Let me tell you. So, I get them on the phone and told them that I do not appreciate you just taking upon yourself to take me out of one program, take me away from a program, and put me in yours. And I don't want to be in yours. Well, that's when hit the fan. After talking to about 8 people, being connected and put on hold and transferred, blase for a good hour, 45 minutes, almost 2 hours, and you know your girl, I'm getting frustrated, okay? And I finally get a person, and after explaining to them that I did not want to be in their program, I'm trying to disenroll, and blase, they told me, you can't do that. this is how it's going to be. You are going to stay with us as long as you're with United Healthcare, and this is what we're doing, and there's nothing you can do about it. They told the wrong person that. I said, honey, who the hell you think you talking to? Okay? Just like I just like I picked you and chose you to be my healthcare provider. Oh, I can fire you. And that's exactly what I'm doing. You can't do that. I click. I hung up the phone because I know that once you choose another insurance company, you don't have to deal with them no more. The other insurance company would deal with them for you. So I called up a good friend of mine and asked them, what insurance company are you with? And they said, Aetna. I said, give me their number. So I called Aetna and I asked them if I can join their company. And they said, sure, let's go down the checklist of what we can provide for you, and let's see how much coverage you have, and how much deductible you have, how much copay, etc., etc. Which with United, I had none. So let's see how they compare. So after we went down my medications, make sure all my doctors were covered, all my specialists was covered, hospitalization would be covered, dental, hearing, eyes, because I've had cataract surgery. You know, guys, I've had knee replacement, and you know I go to a back specialist. They also offered more. They offered acupuncture, which I've never been to, which I've always wanted to try. They offered chiropractor, which I've never been to, and I don't think I ever want to go. I don't want nobody cracking my bones. They already cracked enough, baby. But you still have those options. The only thing that, this one company provided was for my my rec center, me joining any gym that I wanted. It's called the silver liners or whatever we're called. Anyway, senior citizens, it's free. They pay for your membership yearly. That's how come I was always at the gym, and you guys was tagging along with me. But they won't pay for, say, if I need a narcotic, say like my knee replacement, I needed a narcotic for like a good, I would say 10 days, but I'm gonna say 2 weeks. That's why I'm slow at having my other knee replaced, because I don't think they gave me enough. Matter of fact, I know they didn't, because I'm a wimp, I'm a baby when it comes to pain. And baby, woo! Like I said, I'd rather push out another baby at 65 than to have another knee replacement. That's just how painful it was. So they said it's our we have a partner, which is Humana. Now, I knew about Humana back in the day, and I thought they were the lowest insurance company on the total pole to have. When it came to things like dental or eye exam and things like this, or paying a copay or whatever to your doctors, I always heard horror stories about Humana. But once I got on the phone, this lady, we stayed on the phone a good 2 hours. It was such a beautiful, exciting and incited conversation. She explained everything from A to Z, dotted the I's, crossed the T's for me, explained everything like I was a kindergartner, step by step, and I appreciate that so much. The only thing that they took away from me for them, in case I may need a narcotic, is that I can't have the gym. I told her, honey, I'll walk around the block an extra 2 blocks, okay? I don't need that gym, and if I do, with it being local, I only have to pay $4. So I gave up the gym in order to be with Humana. They cover everything I may need, and they don't impose. Matter of fact, they don't even have home health care. All right? So I know that I won't ever have a problem with them imposing on my caregiver or home health care. But in case I may need hospital equipment in the home, like a bed or a raised toilet or railings on the shower or something like that, they covers that. Okay, but they don't impose and bring in their own agency and bring in their own caregiver without your consent. And so I said, now I would like to join your company. When would it come in effect? She said February the 1st. I said, do I have to call United? She said, no, we'll take care of that for you. I say, bet. Thank you very much. Very much. So that's the road I had to take in order to get out of United Healthcare and to get out of them just taking over my home health care. Okay, I'm back with the state of Michigan without any problem whatsoever, compared to United Healthcare saying this is the way it is, this is the way it's going to be, and you can't do nothing about it. Baby, yes I did. Okay, I feel much better. I'm relieved. I'm not as stressed out and as stressful as I was. I was about to say we're not going to talk about it, but yeah, let's talk about it. My mother is with United Healthcare too. I bought her in 6 years ago because 6 years ago United Healthcare was really the main insurance company, health insurance company to get with, because they was providing everything. They were a beautiful company. Now, baby, they're not. So they reeled us in, whoop, just like some fish, until they got us to the right spot, and then they start stepping all over us. So they stepped over my mother this month too. I was on the phone with the people trying to fight and advocate for my mother. She's 84 years old. If you're doing it to me, you're doing it to my mother. It's just sad the way they're just tossing their seniors around. They took my mother's bill pay away from her, and they give you this card. That's how they reel you in. They give you this card to spend monthly just for being with their company. And you're able to buy toiletries, little pharmaceutical things you may need from the drugstore, groceries, and you can pay certain bills with this card. The amount is like, it started out $180 when we first started with them. As of this year, it went up to $223. Well, come to find out, they came and imposed on my home health care. Well, they took my mother's bill pay and grocery pay away, where she can only go to CVS, the pharmacy, and buy things out of their store. $220 worth of how much toothpaste and Epsom salt and alcohol can you buy every month? Okay, you can't, and it's unnecessary. So I had to get on the phone with her so my mother can disenroll out of that particular program and get back to the original program that she went with. Now, my mother's stubborn, okay? And so as soon as I got off the phone with Humana, I called my mother and I said, Mom, I'm on my way over there. I'm about to take you away from home health, United Healthcare, because they are a bunch of liars. And with me being on the phone with them for you a couple weeks or so ago, and they said they did this and they did that, they ain't do nothing. I bet you February 1st is still going to be the same. And from what I understand, we have up to 90 days to change any of this insurance, okay? You have till March 30th. All right. 90 days from January the 1st. So, my mother said, no, baby, I want to stay where I'm at. You took care of it for me. I said, Mom, I don't think they can be trusted. I think they're lying. I found a better company, and I'm going to come over there and switch for you. She said, no. So, I'm going to try and hold them accountable when it comes to my mother and do what they say they were going to do and switch her back to what she's used to. Because all she want to do is pay her gas bill every month. That's all she uses that card for, is to pay her gas bill. That's what helps her out. And I mean, it really helps her out. Okay. Me myself, the card that Humana is giving me, and they're giving us like $20 more. I think she told me my card would be $245. You not only can pay your bills with it and buy your groceries, but you can also buy gas for your car and a couple other things that United Healthcare didn't offer. So that really intrigued me. But just as long as I can go to a doctor office without a copay, you know how them doctors used to say, well, before you can see the doctor, you have to pay $50 or something like that, or without going to the pharmacy and having to pay a copay for your medicine, or things like that. As long as those problems don't come up, then I'm all for it. Okay? Because behind the scenes they're charging Medicare up to the arm and a leg. That's what it all boils down to. What they do behind the scenes using our name and our social security number, thinking they have our approval to do all of this stuff. This is what happens behind the scenes, just so they can sign our name as another person down their long spreadsheet of how many people they have in their company. So this is me keeping you abreast of what I went through with these insurance companies and how I came out the other end. And if I have to do a follow-up video February the 1st or after February the 1st to let you know if I am 100% satisfied, I'll do that. So in the meantime, people, stay diligent, stay vigilant, and stay blessed, and take care of one another. And hit that like button and that subscribe button, and so I can keep you updated, or you stay updated with what's going on with me. Go to Buy Me a Coffee and Ko-Fi, and that's how you can donate to my channel. I appreciate it so much, and I get back with you cats later. See ya.